Last year's NFL season featured a couple of the most concerning injuries that we've witnessed on the football field, with the likes of Demar Hamlin and Tua Tagovailoa. When we see the stretcher come out and an ambulance on the field, fans are understandably more concerned. And so in this video, I'm going to try to teach you a little bit about what's going on in some of these scary situations. Welcome back, everybody. I'm Dr. Brian Sutterer, and my goal in this channel is to help teach you about the medical side of the sports world. So if that kind of thing interests you, then please consider subscribing, especially for the upcoming NFL season. We'll start with a recent example from the preseason. Patriots player Isaiah Bolden gets incidentally hit here from a teammate and goes down in the field, seemingly appearing to be unconscious and not moving. The first thing that we love to see here is urgency, because of course a situation like this is concerning, and we see that the medical staff is right out there on the field within a matter of seconds. Now, in a collision sport like football, whenever we see a downed athlete, especially if there's been some type of mechanism concerning for a head or a neck injury, that's often going to be our first thought when we get out on the field. But in general, if you just come upon an athlete who's down on the field like this and you didn't see or observe what happened, you always have to assume that they could have cardiac arrest, which we'll get to later on with Demar Hamlin. So the first thing that the medical staff is doing when they get out here on the field is, number one, they're not moving the athlete. Of course, we have to assume if somebody is unconscious, even if it's cardiac arrest, that they may have a cervical spine or a neck injury. And so we're not going to move the athlete. I think this is a great example of the medical providers getting down, getting into where the athlete is, not trying to move them, to do that initial assessment to determine, number one, are they having a pulse, and then are they conscious? The fear if we move the player right away and flip them over is that if they have a neck injury, we can make that neck injury worse if there's something like an unstable fracture or a dislocation in the neck. So the first thing when you see the medical staff rush out in the field for a down player, know that their first job is to make sure the player has a pulse and isn't in cardiac arrest. And then number two, always assume if an athlete is unconscious that they might have a neck injury. If we're not worried about cardiac arrest from that initial triage, then the pathway we're going to step through is ABCDE for trauma assessment: airway, breathing, circulation, disability, and environmental exposures. When players are taken off the field on a backboard like this, you'll always notice that their face mask has been removed. And that's because of that first point, the airway. We have to make sure we're maintaining the athlete's ability to breathe by protecting their airway. In some cases, if somebody has an injury to their cervical spine high enough up towards the brain, it can actually affect the breathing function through something called the phrenic nerve or suppression of just the respiratory centers. So you'll always see us remove the face mask. That way, if the athlete is no longer able to breathe, we have quick access to get a breathing tube down their throat and help support their breathing. Then, assuming their circulation is okay, we move on to D, which is the disability. And that's really the part where we're getting into their neurologic function and concern for a neck or a spine injury, which is what they're going to be evaluating here in this process. Initially, we're just asking the athlete to move their arms and legs, and then if they can feel sensation in their arms and legs. After that, we're going to examine their nerves through their head, and then we're going to start to push along the backside of their spine. If at any point in this process they have pain, they can't move their arms, they can't move their legs, or they can't feel sensation, we're going to assume there's a neck injury and we're going to immobilize them on the backboard. But if that's all okay, we can then start to let them move their neck a little bit, actively and passively, and then slowly get up. In this case with Bolden, there was something along that pathway where either he had symptoms in his arms or his legs or maybe some neck pain, where we say there's enough concern for a cervical spine injury. We always want to be extra cautious. We immobilize on the backboard and then get them off to the hospital. Next, we'll move on to injuries where we see more concerning outward displays of a neurologic injury, like with Parham and with Tua Tagovailoa. But first, I want to give a quick shout out to the sponsor of today's video. This video is sponsored by Create, the makers of the first of its kind creatine monohydrate gummy. Create is a pure creatine monohydrate in gummy form. They're perfect for travel and really convenient for daily use, and come in these 1 gram per serving gummies that have a really nice, delicious orange flavor. They taste delicious, and the convenience makes this so much easier than dealing with those typical creatine powders. As a sports medicine doctor, I'm a huge proponent for the benefits and efficacy of creatine supplementation. Simply put, creatine helps our muscles perform. Whenever we exercise, our muscles rely on something called ATP, but we quickly exhaust the stores of ATP within our muscles. Creatine is an amino acid that helps to restore these optimal levels of ATP to improve our muscle function. These benefits can lead to increased strength, improved body composition, and even things like improved cognition with some recent research. Right now, if you use my link trycreate.co/BrianMD and use my code BrianMD, you're gonna get 20% off your first order. Whether you're an athlete already using creatine supplementation or you're just interested in helping to optimize your muscle health and function, then consider checking out Create today, because I really think you're going to appreciate the convenience and the taste of their creatine gummies. Thank you again to Create for sponsoring today's video, and let's get back to our learning. In some cases of a head or a neck injury, we can see an outward display of that internal neurologic injury. And that was the case especially here with what we saw with Tua Tagovailoa, where the public really got a great look firsthand at what we can see with this concept of an impact seizure or posturing. Impact seizure or posturing is the classic fencing response that we'll sometimes see in athletes, where the arms will get extended, locked in this rigid posture as a response to the internal brain injury. In this case, that's what we were seeing with Tua's hands. We were seeing that outward display of the internal neurologic injury with rigidity in these muscles and this posturing position. This is completely involuntary. This is muscle pathways, nerve pathways in his brain and spine that are being activated inappropriately to cause this sort of guarding fence response with this posturing in the hands. Now, the initial evaluation is the same. Medical team gets out in the field. They're going to assume he has a neck injury. They're going to stabilize the neck. They're going to make sure he has an airway, is breathing, and has circulation and a pulse. And then obviously we could see from the outward display that there was this true disability there. There's nothing really that you're going to do in the moment for these impact seizures or for the posturing. Like we'll talk about here in a little bit with Donald Parham, sometimes we see more true seizure-like activity from this increased activation of nerve pathways in the brain. But there's nothing we're going to give, immediately medication-wise to try and break this. Now, if seizures become prolonged or are extended, then you can give different medications, but this is a side effect of what we saw with the brain injury. Part of the reason why we probably still saw Tua on the backboard here is that if there's any concern for consciousness, you can't accurately determine whether or not a player has a neck injury. And here, Tua clearly seemed to have an issue with his level of consciousness. And so then your exam is not reliable when you're trying to ask questions about what's going on in the arms or in the legs. So here, even though this was a concussion, we saw him go on the backboard because we couldn't get a reliable exam to know if there was or was not a neck injury. And also, just when you see that with the hands, it's also going to make you a little bit more concerned. So the other reason why you might see an athlete put on a backboard if they got knocked out is simply because their level of consciousness is such that we can't accurately clear their cervical spine to know whether or not they need to be backboarded. As I mentioned, then we had the case of Donald Parham, where we saw more sustained seizure-like activity with these rhythmic motions that Parham was doing with his hands as he was taken off the field on the stretcher. Again, Parham had sustained a concussion from when he landed in the end zone. And with Tua, that outward display of that electrical activity, that sort of impact seizure, that posturing was what he did with the hands. But with Parham, what we were seeing is that outward display was that rhythmic activity, that almost seizure-like activity in his arms, again because of the underlying concussion. I'm not aware of any data saying if there is a fencing response that makes it a worse injury or not. Certainly, the longer that these types of things go on, the longer that somebody has loss of consciousness, the longer that we see this impact seizure-like activity, the more concerned I would be. But just the fact that we see it or we don't see it, I'm not aware of whether or not that has sort of an impact on ultimate long-term severity. But this definitely looked more concerning just because of that sustained shaking. But again, it's the same concepts, the same principles. We can see the face mask has been removed because, again, we need to make sure we can access his airway if there is something that happens with his ability to breathe and circulate air. With Tua and Parham, of course, there weren't any residual lasting effects that we're aware of. But unfortunately, that wasn't the case here with Ryan Shazier of the Pittsburgh Steelers, who sustained a spinal cord injury and had paralysis after this hit. This is a really important example to talk about because we often are so focused on the neck and the cervical spine that we forget that the spine, the vertebral column, runs all the way down the back. There's a thoracic spinal cord, there's a lumbar spinal cord, and in the case of Shazier, it was an injury to his lumbar spine controlling the legs. That was the reason for his being spine boarded and having his injury. We can see as he came in here to make the impact, yes, there's some load that's transferred kind of into the helmet, but we can see how much he almost gets hyperextended in his back, leading to that, what he had, spinal cord contusion or bruise in the spinal cord. We could see whenever Shazier kind of went and turned over, his leg was almost just completely limp. He grabbed at his low back where that injury would have been, and his left leg just kind of flopped over to the side, presumably from that loss of motor function. We can see his arms work totally fine, but we still have to assess the lower extremities as part of this whole workup. When we're trying to evaluate the neck and put somebody on a backboard, we're also concerned about the legs. So we're asking about movement in the legs, sensation in the legs, and if those are abnormal or if there's midline tenderness in the lumbar spine, we're going to spine board somebody just like with the neck. So don't forget about the lower back and the thoracic spine whenever we see these injuries take place. One great thing I want to point out here on this example are some of the different spine boarding kind of lifting techniques. One thing that you can do is you can roll an athlete to the side. So instead of lifting them straight up, you can simply turn or roll them and then move the backboard in from the side. More commonly, what we'll see is where people are alternated like they are here, where we have one person here and they're staggered like this, and then the backboard gets slid in from in front of the feet underneath them. You only have to lift the athlete a little bit off the ground, slide the backboard under, control, put the athlete back down, and that's one way to get people on a backboard that I think we see more often in the NFL. Before we get to the most significant of these with Demar Hamlin, I think it's important to touch on a musculoskeletal issue for why we also will have the stretcher come out on the field and get somebody off quickly in an ambulance. And a great example of that was Zach Miller, tight end for the Bears. On this play, Miller, of course, suffered a left knee hyperextension that was pretty significant, so we're not going to show it here. But in this case, essentially dislocated his knee. With our biodigital anatomy tool here, I want to highlight that we can't forget about the other structures that run around our joints. When somebody tears their ACL, of course, we think about just the ligaments, but remember there's blood vessels, there's nerves, there's other things that can get injured when somebody injures their joint. In the case of a knee dislocation, there's this big blood vessel called the popliteal artery that runs down the backside of the knee in the popliteal fossa. When you hyperextend your knee, you can actually tear or injure this blood vessel to the point where you cut off blood flow down to the rest of the leg. And while it might not seem as bad as somebody being paralyzed or knocked unconscious, you have a ticking clock of how quickly you need to get somebody's knee reduced and fixed and back to the emergency department before you really could be talking about amputation from loss of blood flow to the muscle and tissue in the leg. The ligaments can be addressed down the road, but you really have to quickly address what's going on if this blood vessel has been injured when somebody dislocates their knee. And we're talking about the order of like hours, like 6 hours or so here before you really need to get somebody quickly evaluated at the hospital before they really could potentially lose their leg. So it's not something we think of to the severity of like a neck injury on a backboard, but a dislocated knee is definitely a situation where you'll see us get the stretcher out, you'll see us get somebody quickly off the field in the ambulance and off to the hospital. Last but not least, the most serious situation that we can see on the field, what we saw with Demar Hamlin. Now, I haven't really talked about this since it happened, but of course, since all of this occurred back earlier in the winter, we learned that, in fact, this had been commotio cordis, this temporary stunning of the heart that causes it to go in an arrhythmia after this impact comes into Hamlin's chest from the Bengals player. Of course, we know that that is going to be a delayed effect. We saw that Hamlin was able to get up. He seemed conscious at first before ultimately collapsing back down onto the field. And this is why we always consider that circulation and cardiac arrest when we see a downed athlete. Because again, in this case, there wasn't really a mechanism to fit with a neck or a head injury for him to be unconscious. He just simply collapsed. So now when we get out there on the field, the first thing we're going to be doing is, yes, we're going to be stabilizing the neck because again, anybody who's down, you have to assume they have a neck injury, but we're going to be checking for a pulse. We can see one of the medical staff members' hands are right in here stabilizing the neck, while the other medical team member is evaluating for a pulse and consciousness. Having a spinal cord injury is obviously bad, but it's not necessarily going to kill you like being in cardiac arrest is. So everything with a spinal cord injury, potentially, you try and maintain stability as best you can. You try and keep them neutral, not move them around, but all of that becomes secondary after you're dealing with the cardiac arrest part of this. This is another great view where we can see one of the staff members at the head while everybody else is working to get his pads off, evaluating that heart, and then beginning CPR and getting those defibrillator pads on. Hamlin's case was unique because if you're going to have cardiac arrest somewhere, probably the best place to do it is at an NFL stadium. You've got tons of medical teams, you have a bunch of AEDs, but unfortunately we see things like this happen outside of medical stadiums in places like parks, little league fields, gyms, you name it. With Hamlin, everything happened the way it's supposed to. You're supposed to be able to resuscitate, get an AED on, and everything played out exactly like it should based on what the medical team is rehearsing and what we hope will take place. While it's absolutely scary to see on the field, know that those medical staffs are very well equipped to handle these types of situations. We go through training every year with how we handle these medical emergency protocols and have things like our emergency action plan spelled out. So have that confidence and that trust that if you see something like this happen on the field, know that those medical staffs are equipped. They've rehearsed these situations, they've practiced these procedures, and have the best capability you would find to try and handle them. So that's it for the video, everybody. Hopefully this is helpful to talk through a little bit of the process of what's going on whenever we see these concerning situations where the stretcher is coming out, the ambulance is rolling out onto the field this upcoming NFL season. Thank you as always for watching. Let me know any questions or comments down below. And until next time, we'll see you later. Bye.